Good everyone. Welcome to our lump CAA assessment. This time we are going to review the anatomy of the reproductive system and the endocrine system. We will also include vitamins, minerals, and continue on the meridian pathways. So let's start the ball rolling with Mom Angel Ko. Good evening, Mom Angel. Are you ready?
Good evening, Doc. Good evening, classmates. Ready na po, Doc.
Okay. So let's start with anatomy of female reproductive system. Number 4 is pointing to
Number 4 is pointing to the uterus po, Doc.
endometrium is indicated by number.
Number 8 po, Doc.
Number 2 indicates
The cervix po.
which number is pointing to the fallopian tubes.
Number 5 po.
Number 7 is pointing to
The ovary po, Doc.
the uterus is indicated by what number?
Number 4 po.
Number 5 is
Fallopian tube po, Doc.
cervix is number.
Number 2 po, Doc.
What is number 3?
The myometrium po.
Which number is pointing to ovary?
Number 7 po, Doc.
Number 1 is pointing to
The vagina po, Doc.
which number is okay, paulit-ulit. Number 1
Yes. Yeah po.
indicates
Number 8 indicates the endometrium po.
which number is pointing to myometrium.
Number 3 po, Doc.
What is number 6 pointing to?
The fimbriae po, Doc.
Which number is pointing to myometrium?
Number 3 po, Doc.
What is number 6?
The fimbriae po, Doc.
Which number is the vagina?
Number 1 po, Doc.
Number 4 is
The uterus po, Doc.
endometrium is.
Number 8 po, Doc.
Number 2 is.
The cervix po, Doc.
Which number is the fallopian tube?
Number 5 po, Doc.
Number 7 is.
The ovary, Doc.
The uterus is.
Number 4 po.
Number 5.
The fallopian tube po.
Cervix.
Number 2 po.
Number 3.
The myometrium po.
Ovary.
7 po.
Number 1.
Vagina po.
Fimbriae.
Number 6 po, Doc.
Which number is pointing to the anus?
Number 1 po, Doc.
What is number 6?
Number 6 is the bladder po, Doc.
Which number is the seminal vesicles?
Number 3 po, Doc.
Number 2 is
The prostate po, Doc.
the prostate. What is number 3?
Number 3 po is the seminal vesicle po.
The rectum is.
Number 4 po, Doc.
Okay, paulit-ulit. Which number is the ureter?
The ureter po, Doc, is number 5.
Number 1 is.
The anus po, Doc.
Which number is the vas deferens?
Number 7 po, Doc.
Number 5 is.
The ureter po, Doc.
The bladder.
Number 6 po, Doc.
Number 7.
The vas deferens po, Doc.
The urethra.
Number 8 po, Doc.
Congratulations.
Thank you
Perfect.
po, Doc.
Good work.
Thank you po.
Maraming salamat. Now we go to Dr. Mary Angeli Templo. Good evening po, Doctor.
Yes, Doc. Good evening. Good evening sa lahat.
The scrotum is indicated by.
Number 12,
Number 7 is.
vas deferens.
Which number is pointing to testes?
11 po.
What is number 12?
The scrotum.
Epididymis is.
Number 10,
Number 8 is.
the urethra.
Which number is the penis?
Number 9,
What is number. Okay, paulit. The urethra is indicated by number.
8,
What is number 6?
The bladder.
Which number is pointing to the vas deferens?
Number 7.
Number 10 is?
The epididymis.
Which number is pointing to ureter?
Number 5.
Number 11 is?
The testis.
The bladder is?
Number 6.
What is a female sex cell called?
An egg.
What is a male sex cell called?
A sperm cell.
Where are the male sex cells produced?
At the testes.
Where are the female sex cells produced?
The ovaries.
What structure are the testes held within?
The scrotum.
What is a zygote?
A fertilized egg.
How are eggs moved along the oviduct to the uterus?
It's wafted along by cilia.
If an egg is not fertilized, which process occurs?
Menstruation.
What is the gestation period in humans?
9 months.
What is the average length of a menstrual cycle?
It's 28 days po.
A fertilized egg embeds into which part of the female reproductive system?
At the uterus.
How many sperm cells are needed to fertilize an egg?
Just 1.
Pero ang dami nilang nakikipag-compete, ah.
Yes, millions po.
Yes. Sperm enters the uterus through
The vagina.
the fetus develops in the uterus via the process of
Mitosis.
what is the joining of a sperm cell and egg cell known as?
Fertilization.
Where does fertilization occur?
In the oviduct.
What is the function of the epididymis?
It's the storage and maturation of the sperm.
How many chromosomes are in a haploid cell?
23.
Sex cells are examples of what type of cell?
Haploid cell.
When does ovulation occur?
It occurs after the follicular phase.
How many chromosomes does a child receive from its father?
23.
What is reproduction of male sex cells called?
Spermatogenesis.
Fertilization involves joining of two haploid cells to
To form a diploid cell.
what is the function of the placenta?
To filter nutrients and blood.
What role does the amniotic fluid play?
It protects the fetus in utero.
What supplies the fetus with oxygen and blood?
The umbilical cord.
What is human reproduction an example of?
It's an internal fertilization.
How many chromosomes does a zygote contain?
46.
The process by which a mature egg cell is released by an ovary is called?
Ovulation.
Which process is used to produce sex cells?
Meiosis.
Congratulations, Dr. Templo.
Thank you, Doc.
Salamat po.
Thank you, Doc.
Good work. Perfect. Wow. Gusto magkamali dito. Ang question na nagkakamali. Now, let's go to Ma'am Ami Glorioso. Good evening. Are you ready?
Good evening, Doc. Good evening, classmate.
Ready as always, I'm sure. Number 1 indicates
A heart,
the most commonly used event to mark the initiation of pregnancy is the first day when?
after the last menstrual period.
Okay, you should know this.
Yes, Doc.
Okay, the vagina is indicated by number.
10,
What is indicated by number 2?
liver,
The urethra is number.
9,
After how many weeks is a developing embryo referred to as a fetus?
At least 8 weeks.
After 8 weeks.
8 weeks, yeah.
Number 5 is pointing to
Placenta.
the urinary bladder is indicated by number.
7.
Number 8 indicates.
Rectum.
Which number indicates the uterus?
Number 4.
What is indicated by number 6?
Amniotic sac.
In which trimester can movement of the fetus, often referred to as quickening, first be felt?
The second trimester.
Which number indicates the umbilical cord?
Number 3.
The second trimester is from week 13 to
13 to 28.
egg fertilization takes place in.
Fallopian tubes.
Number 4 indicates.
Diaphragm.
The mammary glands are indicated by number.
2.
How long does pregnancy usually last from conception till childbirth?
38 weeks.
What is indicated by number 7?
Transverse colon.
Which number indicates the pancreas?
Number 6.
Number 8 is pointing to.
Pondus of the uterus.
The lactiferous ducts are number.
Number 3.
By the time a fertilized egg attaches to the uterine wall by implantation, it is referred to as a.
Blastocyte.
Number 1 is pointing to.
Aorta.
The small intestine is indicated by number.
10.
Delivery by cesarean section is not generally recommended before.
39 weeks.
Number 11 indicates.
Cervical canal.
Yeah, the mucus plug in the cervical canal.
Yeah.
Which number indicates the stomach?
Number 5.
What is indicated by number 9?
Amniotic fluid.
An early term baby is born.
37 or 38 weeks.
Endometrial tissue appearing outside of the lining of the uterine cavity is known as.
Endometriosis.
Which of the following are symptoms of pre-invasive cervical cancer?
There are no symptoms.
Small asymptomatic sacs of fluid or semi-solids material on an ovary are known as.
The ovarian cyst.
Bacterial infections of the cervix, uterus, fallopian tubes, and ovaries cause which of the following?
Pelvic inflammatory disease.
What is the medical term for pain during menstruation?
Dysmenorrhea.
What is menorrhagia?
A heavy menstrual period.
While all breast lumps should be investigated, what percentage of lumps tend to be benign?
90%.
What percentage of breast tumors arise in the upper lateral quadrant of the breast?
90%.
Okay. Anong acupuncture point do you find there?
Ay, Doc, hindi ako nagtatry sa may,
Yeah.
sa may, sa may breast.
Gusto sumagot. Who would like to answer? What do you call that point there? Probably this has something to do with why ano. Anyone? What do you call that point?
Line 17.
Okay.
Line 17 sa gitna.
Sa gitna,
Ay, power.
upper lateral quadrant to. Upper,
Hindi ko alam.
Sa lang ba yan, Doc?
hindi mo abot sa
Hindi.
Upper quadrant.
upper outer quadrant, upper lateral quadrant. Go.
Upper lateral.
Kala ko ba master nyo na lahat yan?
Ay, grabe.
Pericardium, Doc.
Yeah.
Diba? Ang nandun sa. Pericardium 1.
Okay, go. Congratulations. I'm happy.
Very correct.
Kinalaman kaya yan? Kasi, kaya that could be the reason why ang dami. Kasi, ewan ko lang ha. Okay, siguro we discuss that in more detail later. Okay. Wow, great. In stage 2 breast cancer, the tumor size is greater than,
2 cm.
wow. A surgical operation to remove the womb is called
Hysterectomy.
hysterectomy, hindi high. Okay, what is the condition known as amenorrhea?
The absence of menstrual period.
A prolapse of the uterus can be caused by which of the following?
Weakened pelvic muscles.
Okay. So, anong tawag dyan sa, okay, later. Ay, tapos ka na sa diagnosis sa TCM. What do you call this condition? Like, what pattern is this? Remember, sinking.
Pelvic muscle.
Spleen chi, sinking, right? Remember? Spleen chi, ang subtype niyan is spleen chi sinking. And yan ang itatakal natin when we go to the next mode. Okay? You should always correlate. The use of antibiotics can sometimes lead to increase in the growth of the candida fungus within the vagina. What is this condition called?
Cold vaginal crash.
A cervical screening test, previously known as a smear test, is a method of detecting abnormal cells on
Cervix. The cervix.
Okay, what is the most common cause of cervical cancer? Kanino niya nakuha yung virus? What do you call that virus?
HPV, Doc.
Wow.
HPV.
Papilloma.
Human papilloma virus.
Ano yung partner mo? Doon mo isisisi sa kanya. Okay. Eh baka maano tayo. Okay, so I'm happy that a lot of you know this.
Human.
The presence of benign tumors in the muscular wall of the uterus causing increased urination, lower back pain, and heavy menstrual bleeding are called.
The uterine fibroids.
Okay, congratulations, ma'am.
Okay, Doc. Thank you po.
Wala pa nagkakamali ah. Okay, what you should do, you should not forget TCM every time we talk about anatomy and physiology. And you will see a lot of parallels, no? Magkakapareho. And to think that TCM was ahead. Wala lang tayo microbiology in TCM, of course. Now let's call on Sir June Azariel. Are you ready?
Yes, po, Doc.
Good. Which of the following is the term used to describe a non-cancerous increase in the size of the prostate?
The benign prostatic hyperplasia, Doc.
Incidentally, we would like to invite you on Saturday. We're going to discuss prostate issues. Titingnan natin kung paano natin matutulungan ang mga may prostate problem. What is the medical name for the condition characterized by pain in the curved structure at the back of the testicle in which sperm matures and is stored?
Epididymitis, Doc.
Okay, ganito ha. You should practice not to sound parang nahihirapan. Epididymitis.
Okay, Doc.
Dalawang isip ka. That's if you are from lung, you should pronounce it with confidence. Epididymitis. Practicein mo yan. Okay, go. The inability to develop or maintain an erection of the penis during sexual activity is called
Erectile dysfunction, Doc.
okay. Accumulation of fluids around the testicle causing a soft and non-tender swelling is called
Hydrocele, Doc.
what percentage of men diagnosed with prostate cancer are over the age of 50?
Around 99%, Doc.
If a man loses one testicle due to surgery for testicular cancer, Will he be infertile thereafter?
No, depending on range of the factors, including other treatments such as
The answer is no.
IUD. Yes po.
At-
Possibly po.
Yeah, depende sa ano niyan. Okay, your answer is
Hello po.
yung answer mo?
Possibly po.
Okay. Actually, there is no answer here. Depende, no?
Opo, possibly po.
A twisting of the spermatic cord causing a rapid onset of testicular pain is called
A testicular torsion, Doc.
a visibly or palpably enlarged vein on the scrotum and an aching pain are signs of
Varicocele, Doc.
what is the name for the medical condition in which the erect penis does not return to its flaccid state despite the absence of stimulation for more than 4 hours? This is very common.
Trapezium, Doc.
Priapism.
Trapezium.
Section of the glands or head of the penis is known as
Balanitis, Doc.
balanitis.
Balanitis.
The most common method of reproduction in males is called
A vasectomy, Doc.
which of the following can contribute to male infertility?
Smoking po, Doc.
Condition where the foreskin cannot be fully retracted over the glans penis is called.
Chemosis.
Okay. What is the medical term for the condition of lack of descent of one or both testes into the scrotum?
Cryptorchidism.
Okay. What is the medical term for an underproduction of male sex hormones? Result
Hypogonadism.
in sperm production and fertility. Hypogonadism.
Hypogonadism.
Okay. The most frequent cause of acute onset scrotum pain in adults is
Ito na naman tayo.
kanayin mo na sarili,
Epididymitis.
nabubulol ka, ulitin mo.
Epididymitis.
No. Again,
Epididymitis. Right.
lang. Again.
Epididymitis, Doc.
Hindi pa din. Epididymitis. Ulitin mo.
Epididymitis, Doc.
Okay. Formation of large, fairly discrete nodules in the transition zone of the prostate due to hyperplasia of prostatic stromal and epithelial cells is known as
Benign prostatic hyperplasia, Doc.
prostatic hyperplasia. In short, it's PH. Okay, dapat BPH na yung ano natin kasi napakahaba. Complete descent prostate cancer is the blank leading cause of cancer-related death in men. Pang-ilan?
Fifth po, pang-lima po.
Which of the following accounts for 9 to 95% of inflamed prostate blood or prostatitis diagnosis?
A chronic prostatitis pubic pain syndrome po, Doc.
Okay, kailangan, okay, I hope you will all attend on Saturday because we're going to discuss the protocol for men over 40, over 50, no? Kasi ang prostate cancer, wala yung symptoms sa una, no? So we will get to learn things like PSA, how to do prostate massage, whatever. And this is where we can come in very, very, you know, we have to be more responsible and we need to really train these people, train ourselves to be more vigilant. Huwag tayong pakampante. Number 5, which of the following is a common cause of erectile dysfunction?
Atherosclerosis, Doc.
So there are two, ano dito, atherosclerosis. Hardening yan. of
Atherosclerosis, Doc.
Sclerosis. Okay. Which of the following has one of the highest survival rates of all cancers? at around 98%.
The testicular cancer, Doc.
In what age group is testicular torsion most common?
12 to 18 years, Doc.
Which of the following is a connective tissue disorder that can involve the growth of fibrous plaques in the penis, causing pain and abnormal curvature?
Peyronie's disease, Doc.
Sickle cell anemia can sometimes be a cause of which of the following?
Rheumatism, Doc.
An inflammation of the glands, the foreskin is known as another tab, glands and foreskin.
The balanopat, how do you spell it? The balanopotitis, Doc.
During a vasectomy, which part of the male reproductive system is severed and then tied or sealed?
The vas ferens, Doc.
Vasectomy. Male infertility affects approximately what percentage of all men?
7% po, Doc.
The skin condition lichen sclerosus erythrophicus is regarded as a common cause of which of the following?
Hemosis po, Doc.
A birth defect of the urethra where the urinary opening is not at the usual location on the head of the penis is called
Hyposphagus, Doc.
the most common birth defect of the male genitals is
Creptorchidism, Doc.
torquidism. Okay, very good. What is number 8?
The pancreas po, Doc.
Glands of the endocrine system produce what?
Hormones po.
Number 2 indicates
Thyroid gland.
a special feature of endocrine glands is that they don't.
Have that.
Good. Number 5 indicates the
The testes.
endocrine glands secrete hormones directly into.
The interstitial space, Doc.
Number 1 indicates
Pituitary gland po.
parathyroid glands are indicated by number.
7.
What is number 3?
Adrenal glands po.
Which of the endocrine organs is also an organ of the digestive system?
The pancreas.
The ovaries are indicated by number.
4.
What is number 6?
Pineal gland po.
How big is the pineal gland in an adult human?
5 to 8 mm long. Millimeter long.
Following endocrine glands has anterior and posterior portions which produce different hormones.
The pituitary gland po, Doc.
Which of the following are referred to as the neuroendocrine glands?
The hypothalamus and pituitary gland po, Doc.
Congratulations, Sir June. Excellent job. Walang mali. Keep up the
Thank
good.
you po, Doc.
At least I'm confident that you've all been studying, and this will all pay off, I tell you. Hindi tayo nakakahiya sa mga pasyente natin. Maraming salamat. Now,
Ako po, Doc.
Ms. Sola, good evening po.
Good evening po. Sir.
Thyroid stimulating hormone, or TSH, is secreted by which gland?
Pituitary gland.
Kailan siya magsisecrete ng TSH? Kung mababa ang thyroid hormone o kung mataas ang thyroid hormone?
Hala. Pag mababa po.
In fact, a very good endocrinologist, lalo na pag merong thyroid mass, neck mass, para mas tipid, kunin mo lang yung TSH muna. Hindi yung thyroid panel kaagad kasi magastos. Do you follow? Especially when you want to monitor your progress. So if the TSH is mataas, ibig sabihin, mababa yung thyroid hormone mo. Okay? So pag magkonti lang, mataas. Meron kang hyperthyroidism. Okay? So, we want you to be very with this because I'm very confident someday the lung practitioners will align themselves with the medical colleagues. O, di ba? Excited. O, di ba? Where is testosterone produced?
The testis.
Which gland in the brain secretes antidiuretic hormone or ADH?
Pituitary gland.
How do hormones in the endocrine system move around the body?
Via the circulatory system.
Where are the adrenal glands located?
On top of the kidneys.
Adrenaline is secreted from,
The adrenal glands.
okay, this is the reason why pag nasunugan tayo, wag naman, di ba nagiging mas malakas ka? Dahil nagkakaroon ka ng adrenaline rush. Okay? Kung ang buhay natin, parating ganun everyday, eventually, manghihina yung kidneys mo. Okay? And then when you're also under a lot of stress, you will also affect your adrenals. Siyempre, pag stress ka, sikit ka ng sikit ng, parang di kang on the go, no? Eventually, you will also raise, kasi it produces more glucocorticoids. Glucocorticoids, it raises your blood sugar. Kaya if you don't want your blood sugar to really shoot up, you have to learn how to relax. Gawin mo lang yung ano kaya mo, o magpa-acupuncture ka on a monthly or twice a month basis. This is what we want to do. Okay? We want to educate everyone. So, gusto nyo ba yun? Tuloy-tuloy yung mga pasyente nyo. So, you need to educate them. You need to show them that you're really good. Okay? And there are so many people out there who are so stressed, especially CEO or yung mga talagang maraming hawak na responsibility. There's a lot of money, but remember, it comes with a price. May kapalit yan. So, these people should be trained on how to look at. Kaya, if you all love the lecture on the sublingual veins, unahin nyo na, no? Tingnan nyo na. Tingnan mo rin yung palate para makita mo kung ano yung condition talaga. Don't wait for the tongue to turn purple. Because most of the time, wala kang nararamdaman. Especially if under the tongue, nakita mo, nagkaroon ng, I'm sure some of you, or probably all of you, have tried looking at the back of, under surface of your tongue. So, kailangan may mga pagbabago yan habang wala pang symptoms. Did you all do that? Okay.
Opo.
Hope you did. And don't panic. Kasi pag natakot ka din, this will affect your health as well. So, this is where you need to really teach somebody how to do acupuncture. And dapat nag-iiba yung itsura ng tongue. Okay, adrenaline, ay, paulit-ulit. This is easy. Okay, which of these is not an endocrine function of the pancreas?
The secretion of pancreatic amylase.
Because this needs a tube, no? So the pancreas is both an endocrine and exocrine. So pag exocrine function po ito, pag exocrine meron ng tube dumadaan. Okay? What type of hormone is testosterone?
Steroid hormone.
The beta cells in the pancreas secrete which hormone?
Insulin.
What about the alpha cells? Sino nagsisecrete? Anong sinisikret ng alpha cells?
Glucagon.
Very good. Where is the pituitary gland located?
In the brain.
Which reflex is adrenaline most often associated with?
The fight or flight reflex.
What is the name given to insulin deficiency?
Type 2 diabetes mellitus.
Absolute, ibig sabihin, ano ba to? Hindi ka talaga nagpaproduce ng insulin. Okay? Sa type 2, nagpaproduce ka ng insulin pero may humaharang. Do you follow? So the answer should be type 1 diabetes mellitus. It's okay, Sir Darwin. Now you know. Don't feel frustrated. You're still good. Okay. Antidiuretic hormone is secreted in response to
Decrease plasma volume.
Okay. If you are dehydrated, nagtitipid siya, diba? Which hormone increases blood glucose levels?
Glucagon.
Where are the parathyroid glands located?
Behind the thyroid gland.
What is one of the main roles of thyroxine?
Increase basal metabolic rate.
What are steroid hormones made of?
Lipids.
Which one of these is not a function of estrogen?
Decreasing metabolism.
Which area of the brain synthesizes ADH?
Hypothalamus.
What kind of hormone is estrogen?
Steroid hormone.
What is the main function of cortisol? Ito na yung sinasabi ko kanina. Yan.
Increase blood glucose levels.
Kaya, huwag ma-stress. Dapat ugaliin magpa-acupuncture sa magagaling. Okay, which of these is not an indicator of an overactive thyroid?
Weight gain.
What effect does insulin have on blood sugar levels?
Increase the synthesis of glucose.
No. The purpose of insulin is to actually increase absorption into the cells, specifically the skeletal muscle cells. Okay? So pag yun ang effect ng insulin. Increase the absorption into skeletal muscle cells. What substance is used to make steroid hormones?
Cholesterol.
Glucagon is secreted by which type of cell?
The alpha cells of islets of Langerhans.
Which of these hormones is released in response to stress?
Cortisol.
What does it do to the blood sugar? In cortisol. Raises the blood sugar.
Increase, yeah.
Yes. Remember that. Kaya dapat yung mga pasyente natin relax, no? Look at acupuncture as a maintenance thing. Okay? Which of these increases the metabolic rate?
Thyroxine.
Which kind of hormone crosses the target cell membrane?
Steroid hormone.
What is the main function of parathyroid hormone?
The regulation of calcium and phosphate levels.
Which one of these is a sex hormone?
Estrogen.
How many vitamins are universally recognized at this time?
13.
How many of the recognized vitamins are soluble in water?
9.
The 4 vitamins that are fat soluble are vitamins A, D, E, and
A.
what do we call chemical compounds with a similar molecular structure and the same biological activity to a particular vitamin?
Vitamins.
Ascorbic acid is the vitamer of
Vitamin C.
which of the following is a vitamer of vitamin B1?
Thiamine.
Which of the following conditions is caused by a deficiency of vitamin B1 in the body?
Very.
Which of the following vitamins is produced by microorganisms in the intestine? Kaya dapat may mga probiotics.
Vitamin K.
Yes. Scurvy is a disease resulting from a lack of
Vitamin C.
which of the following vitamins is synthesized from cholesterol in the skin during sun exposure?
Vitamin D.
A deficiency of vitamin D in the body causes weak or soft bones in children, a condition known as
Rickets.
which vitamin helps to maintain healthy skin and eyes and strengthens the immune system.
Vitamin E.
A healthy vegetarian diet can provide all of the required vitamins, but vegans who eat no animal products at all need to take supplements of which vitamin?
B12.
Which of the following conditions can a deficiency of vitamin B12 lead to?
Anemia.
Night blindness or nyctalopia is a condition that can be caused by a deficiency of.
Vitamin A.
Congratulations, Sir Darwin. Good job. So alam mo na naman ang effect ng insulin, ha? So mayroon tayong kasi may insulin resistance. That's why kasi may humaharang, no? Okay. Kasi pag hindi na absorb 'yon sa skeletal muscle side, tataas yung blood sugar mo. And so mas tumaas yung blood sugar, mas mataas yung insulin. And remember, pag may insulin, mataas yung insulin mo, it will convert the sugar into fat in the liver. Kinakakaroon tayo ng fatty liver. Okay? Maraming salamat. Good job. Very good job. Let's now call on Miss Joy. Good evening, Ma'am Joy.
Good evening po.
Which of the following vitamins need to be consumed every day because they are not stored in the body?
Vitamin B daw.
Most of the B vitamins, no? One
Yes,
possible
most of the B vitamins. Sorry.
the outer layer of the skin due to increased amount of keratin is chronic exposure to arsenic, deficiency of which vitamin is what is another possible cause.
Vitamin A daw.
The recommended dietary allowance of vitamin A is around
0.6 mg for women and 0.7 mg for men.
yung mga naturopaths, they should know all of this. I'm sure memorize nila lahat to. Which of the following vitamins are lost when vegetables containing them are boiled?
Vitamin B and C.
Foods such as bread and breakfast cereals are often fortified with niacin. What is niacin a vitamin of?
Vitamin B3.
Folic acid is recommended as a supplement for women during pregnancy to help prevent neural tube defects in the baby. Folic acid is a vitamin of.
Vitamin B9.
What is the recommended dietary allowance of folic acid for pregnant women?
0.4 mg.
Pellagra is a disease with symptoms of diarrhea, dementia, inflamed skin, and mouth sores. It is caused by a lack of what vitamin?
Vitamin B3.
An overdose of more than 2 grams a day of vitamin B3 can cause.
Liver damage, doc.
Okay, you have to be responsible for this, Sada, but alam na talaga yung dosage. What is
Yes, doc.
recommended dietary? What is the RDA of vitamin B3?
Vitamin B3 is 13.2 mg for women and 16.5 mg for men.
Vitamin K is needed in the body for.
Blood clotting.
Which of the following is a vitamin for vitamin K?
Phylloquinone.
Riboflavin is a vitamin of which vitamin?
Vitamin B2.
Hair loss, brittle fingernails, and a rash, often facial, are symptoms of a deficiency on which of the following?
Vitamin B7.
Vitamin B7 deficiency can be caused by the action of a chemical compound called avidin, which inhibits its absorption. Which of the following contains avidin?
Raw egg whites.
In nutrition, a mineral is.
A chemical element.
How many major minerals are found in the human body?
5, doc.
The major minerals are calcium, phosphorus, potassium, sodium, and
Magnesium.
other minerals in the human body are referred to as.
Trace elements.
That the following major minerals is needed in the body for muscle, heart, and digestive system health, as well as for building bone and supporting the synthesis and function of blood cells.
Calcium.
Approximately what percentage of the calcium in the human body is in the bones and teeth?
99%, doc.
Spinach is a good source of.
Magnesium.
How much sodium is the RDA?
1.5 grams. Doc.
Okay, remember that. Yan lang po ang kailangan natin na sodium per day. How much sodium is there in 1 teaspoon of salt?
Kaya nagulat ako dito sa sagot dito sa number 9, doc, na 2.4 grams.
Yeah.
So, ibig sabihin, lagi ako nag-i-exceed ng sodium.
So, hindi siya mg. Alam nyo na yan, ha? Imagine 1 teaspoon is 2.4 grams. So, Huwag na gumamit ng salt kasi lahat ng pagkain, lalo pag binibili mo lang, o yung mga,
Eh,
lalo
sobrang dami ng salt.
process, dami na ng salt noon. Kaya now, we see a lot of people with kidney issues.
Yeah.
1 grams per day.
That's why take pink salt, Doc, because you have the other trace minerals.
Yes, yeah.
Yeah.
But what makes people love? They love.
Yeah. Sodium makes everything taste better.
Yeah. There, ha? So dapat, wag na gamitin yung salt mo. Kasi practically, hindi lang naman yung kakainin mo, lalo na pagluluto ka ng egg. Wag mo na lagyan. Eh, what more yung mga no? Grabe, tingnan nyo yung yung nakalagay sa label, yung mga instant noodles. Wow.
Kaya nga, Doc.
Yeah.
Yes. Need to watch what you're eating.
Too much sodium in the diet can lead to
Hypernatremia.
is iodine or iodine a major or a trace element in the human nutrition?
A trace element.
Which of the following foods is a good source of iodine?
Seaweeds.
Too much iodine in the diet can lead to
Hyperthyroidism.
which of the following is required in the body for the production of hydrochloric acid in the stomach?
Chlorine.
If a person is suspected of having anemia, a doctor is likely to take a sample of the person's blood to check the level of which of the following trace elements?
Iron, Doc.
What is the percentage contribution of phosphorus to human body weight?
1%.
Vitamin D has played an essential role in balancing the levels of which of the following minerals in the body?
Calcium, Doc.
When is the best place to go out under the sun?
When, Doc?
Yeah, at what time?
When? Nag-iba na kasi, Doc. Dati, di ba, early morning ang sabi. Tapos biglang may lumabas na na parang you should go around when it's hotter around 11, but only for a shorter period of time. So
Or
which do we listen
Before
to?
10. Before 10 a.m.
Or 10. Pero ngayon mainit ang 8. Grabe.
Kaya nga po, Doc. Dati pagka nung newborn yung baby, like you have to go out like around 6:30 nung nasa Zambales kami. Kasi mainit.
Yun.
So depende, Doc, siguro. Depende ba, Doc, kung saan ka nakalugar?
Oo naman, sa Baguio naman siguro kung hindi naman umiinit dyan.
Dito, Doc, hinahanap yung araw.
Ni Doc, mas mainit sa Baguio. Actually, we're closer to the sun.
If you find the sun, tita.
Yeah, I think.
Iodine is required in the body for synthesis of thyroid hormones. What is the RD?
15 milligrams.
Magnesium is the fourth most abundant mineral in the human body. How much of it is contained within bones?
Approximately 50%.
What is the most likely cause of developing mineral toxicities in the body?
The use of supplements.
Have to be careful. Kaya knowledge of these things is very, very important. Yung iba natagtad na sa daming kaya okay. Hindi ko na nasabihin.
True.
Hypertension can result from a chronically high intake of which of the following minerals?
Sodium grams.
Approximately what percentage of the iron in the body is contained? There is approximately 2 grams of zinc in a typical adult human body. What is the RDA to maintain this level?
RDA is 11 milligrams.
Brazil nuts are possibly the richest food source of which of the following?
Selenium.
How many Brazil nuts could you eat to get 100% of your RDA of selenium without risking overdose?
Doc, totoo ba to? Less than 1?
Yes.
Malaki yata
Hindi
yung
naman.
nose mo yun.
Nakatry ka naman ng Brazil nuts?
Oo,
Yeah,
Doc.
Totoo. Nagulat ako sa, teka, less than 1? I usually eat about 5.
Oo, Dok.
Parang after 5 yun, medyo umay ka na eh.
Okay, less than 1, di hatiin mo.
Pero ibig sabihin, less than 1, ng konti pala, nakakabitin naman.
Rare, but consuming an excess of which of the following trace elements could induce it by impairing its absorption.
Zinc.
So not too much of zinc.
Yes, Doc.
Vegetables, fruits, nuts, cinnamon, and whole grains are high nutrient density sources of
Manganese.
which of the following trace elements enhances the action of the hormone insulin, helping in the regulation of blood glucose levels. This is already proven.
Chromium, Doc.
By mga chromium picolinate. I'm sure expert niyan si Ma'am Janine. Okay. A high nutrient density dietary source of chromium is,
Red grape juice, Doc.
together with the seed.
Yes.
Congratulations, Ma'am Joy. Perfect. Grabe.
Thank you, Doc.
Good job. Very good job. Now let's go to Meridian Pathways. Let's call on Ma'am Janine Chan, who is very ready.
Ako, ninenervous ako, Dok.
The channel begins where?
The stomach canal begins in the inferior to the center of the pupil of the eye. Tama, Dok?
I'm sorry.
Between the eyeball and the infraorbital margin.
Uy, hindi.
Dito, di ba, Dok? Stomach?
Saan mo kinuha yan?
Dun sa pinadala niyo, Dok, na notes. Muna ako. Baka SI yung kita ko, hindi stomach.
Actually, sa LI-20 siya. Sa
Okay.
siya.
The
Okay.
lateral side of the nose.
Yeah. The side of the
Lower side of the nose. Okay.
Okay, what's
Sorry.
next?
stomach one. Yeah. So,
Wait.
LI-20.
LI-20. Medyo matindi to, but we have to study this. Na tayo sa
Yes, Lord.
Thank you. Where does the stomach channel meet the bladder channel?
Stomach 5 and stomach 6.
What part of
Doc,
40, the bladder 40.
Bladder 1.
Doc, hindi ko talaga naiintindihan pa to eh. I got this lang from all the pictures.
Bakit umabot tayo sa bladder mo?
Doc, I can't understand. May maingay, Doc eh. Background.
Look at this part here.
Yes, Doc.
Bladder 1.
It's where the stomach channel meet the bladder channel. Okay? Medial canthus of the eye. At the medial side of the canthus. Or the canthus of the eye. Yan siya nagmi-meet. Okay, anong significance nito? May significance yan.
Walang, Doc.
Ano, ni bladder, kidney. Sinong partner naman ni stomach? Si LI. So they are both who. You try pressing your area here. Nare-relieve siya. Okay, after meeting the bladder, where does the stomach channel? So doon sila sa inner canthus. Dito ha.
Stomach 8, head.
Saan siya nagpo-proceed?
Ako, Doc, stomach 8.
No, ang layo.
Doc, dapat yata class 1 yung tinatanong mo, hindi class 2.
Ay, ano. Okay, who would like to answer?
Can I try it, Doc?
Stomach 1, Doc.
Can I do 28?
Stomach 1. It descends laterally along the infraorbital ridge at stomach 1.
Parang dito siya nag-meet kasi don't confuse the channel with the collateral. Dito siya nag 1, 2, 3, 4.
Dok, hindi ko alam kung sa akin lang ba, parang naging choppy.
Oo, choppy.
Parang naging choppy po.
Si Doc nawawala.
Stomach 4, the stomach channel enters where? Saan ba yung stomach 4? Di ba nandito?
Doc,
Stomach 4. Okay. Look,
Dok, we can't hear you.
how come?
ayun.
Ayun, biglang meron na.
Yun.
Weird.
Kanina po hindi.
From stomach 4, saan ba yung stomach 4? Saan siya papasok?
Circles the mouth.
Yeah, the upper gum. Remember,
The
the
upper gum.
lower gum is the large intestine. So stomach 4, pang stomach 4, papasok siya sa
Upper gum.
upper gum. Upper gum na tayo ha.
Upper gum.
Channel
Doc, nawawala ako.
Parang pag may
There's a wind somewhere.
Okay,
Doc, nawawala ka na.
I can hear you.
Dok, nawawala-wala, Dok. Hindi ko alam kung pag merong naggagamit na iba ng mic, tas nawawala kayo, Dok.
Okay, let's mute the others. Okay, what about that? Yun. From the
Okay,
up,
Doc.
the stomach channel will curve to meet with what 2 points?
Do 28.
And
Do 26.
you must have the same reference. Okay, good. Sige, REN 24. The stomach channel will circle around the lips to meet the REN or conception vessel at what point?
CV24, tama ba yun, Doc?
Or saan? Dito sa mentolabial groove of the chin. So may kinalaman pa rin sa stomach, ha? Okay, when you do facelift, you should not forget needling this here. Okay, stomach from REN 24, the stomach channel will run laterally across the cheek to meet what stomach point? Lateral,
5,
yeah,
tama ba, Doc?
and what? Ano pang point? Stomach 6. At the angle of the mandible. Okay?
And stomach 6, Doc, sabi mo?
Stomach 6.
Stomach.
So prep sa 5, tapos 6.
Okay.
So I presume you would know how to locate stomach 5 and stomach 6. From the angle of the mandible, the stomach channel ascends anterior to here to pass.
What? The GB3?
Tapos yung stomach, yeah, GB3. Stomach 7 to GB3.
Okay, stomach 7.
Stomach 7 to GB3. From
Okay.
the stomach channel ascends within the hairline of what region of the head?
Forehead.
No.
Diba?
GB,
Stomach 8.
Yun. Temporal region.
temporal region. To meet what?
Region. Okay.
Stomach 8. Stomach 8. Napakasarap. Okay? So from GB3, the stomach channel ascends within the hairline of the temporal region of the head. Parang sungay. Ay, by the way, how would you know kung nag-recede na yung hairline mo? Or how do you determine your anterior hairline? What will be your from yin tang? Do you see what I'm doing? I'm trying
Yes,
to
Yeah, yeah.
not find dito above yin tang. Dapat andun yung anterior hairline mo. Sige. Yung iba wala namang Okay. The stomach channel follows the hair-like, passing GB456 to meet what point?
GB20.
No, 224.
220.
Hanap ako. The stomach, ito naman, divergent channel. Where it branches from where?
The thigh. The thigh, do?
Yeah, the middle of the thigh. So
The
galing
middle.
magbabranch siya sa middle, aalis siya sa middle of the thigh. Kaya yung iba, try nyo yung ano nyo, yung mga sumasakit sa middle of the thigh.
Mm.
Stomach divergent channel. From the middle side, the divergent channel of the stomach goes
To the abdomen.
good. After entering the abdomen, the stomach divergent channel goes where?
Connect to the stomach, then disperses in the spleen.
Good.
Correct.
After dispersing in the spleen, the stomach divergent channel.
Oh, wala ka ulit, Dok. Heart alongside the esophagus to reach the mouth.
Okay.
Dok, may maingay ulit. Aso. Okay.
Kay Ma'am Mary Angeli po ata.
Okay na. Okay. Number 15. After emerging from the mouth, the stomach divergent channel connects back to its primary. How does it connect to its primary meridian?
Runs beside the nose and connects with the eye. Stomach meridian of food yang
Connects with the eye.
connects with the eye.
Nose connects with the eye. And then, mag-unite na siya sa primary channel. Okay. The stomach luo connecting channel originates where?
On the leg, lateral to the shin bone.
Okay. At what particular point? Which is called
Stomach
the
40.
luo connecting point of the stomach.
Stomach 40.
Stomach 40. Very good. Kaya nga stomach luo na yan eh. So you should know the luo connecting point of the stomach. From stomach 40, the luo channel travels where?
To the spleen.
Okay. Medial aspect of the lower leg to join the spleen channel. Kasi if you needle stomach 40, it will actually tonify the spleen. Okay? It will sedate the stomach 40, and then it will tonify its interior exterior organ. Number 18, the luo stomach channel, after connecting with the spleen, ascends the leg and trunk to
the nape of the neck.
The neck. Okay, and then it converges with the chi of the other yang channels. Kaya napaka-importante po ng stomach. Actually, stomach and spleen, core po yan ng katawan natin. Don't ever forget that. Most of the patients, or all of the patients, do not forget the stomach. From the nape, the stomach luo connecting travels where?
To the face.
Internally, to terminate at what area?
The throat.
Oh, lalamunan. The primary spleen where?
Doc, sorry.
Where does the primary meridian of the spleen begin?
The toe. At the foot.
Toe. Kasi meron din lateral side, which is liver 1, right?
Yes, the spleen 1. Spleen 1.
Lateral side of big toe. You should be very specific.
Lateral side of big toe.
Lateral, dyan yung ibang channel. Congratulations po, Ma'am Janine. Kailangan talaga natin ito matutunan kahit pahapyaw lang. Because we will then understand why we need to needle those points. Now let's call, thank you so much, Ma'am Janine.
Thank you, Doc.
Victor Ginto Jr. Good evening po, sir.
Good evening, Doc, and sa lahat po.
Yeah, the spleen primary channel runs along the medial aspect of the foot following what line? Ano yung natin?
From spleen 1, the channel courses along the medial aspect of the foot.
Okay, pag nagbago na yung color ng skin. Okay?
Yes, yung red and white line.
Yes, where the skin changes colors. So you know that, no? Nakita nyo yung sa may first few points ng spleen. The spleen primary channel ascends in front of the medial malleolus at what point? Napakaganda nitong point din, as in.
Spleen 5.
Very good. After passing spleen 5, saan pupunta ang primary channel?
Ascends interior to the medial malleolus and continues along the posterior border of the medial crest of the tibia.
And then, papunta sa what channel?
Spleen.
Cross. Kasi sinabi mo, A-tune, superior to the medial malleolus. So there must be something there.
Bali, dun sa spleen,
So, sabi mo,
meron din kidney. May
follow-
kidney rin.
okay, sa tibia, no? Posterior border ng tibia, papunta, maintaining pa rin yung medial aspect ng leg. Point
Bali,
8-tune.
spleen 9. Spleen 9 yung before the popliteal.
Okay, napaka-significant po nung 8-tune superior to the medial malleolus. Kasi dito siya nagko-cross and then it travels in front of what channel? Actually, if you like
Liver.
Liver, Doc.
very good. That's why you should always compare the spleen pulse and the liver pulse, diba? The middle.
Opo.
Okay. Sige, I find this very challenging. We can all learn how to do pulse by just talking via Zoom, as long as you know how to do it, right? And in my experience, I would usually feel kasi diba, like if you locate the pulses, kailangan mo muna hanapin yung styloid process ng radius, right? And lalo na pag malaki ang tiyan, slippery pulse. So pag slippery pulse yan, you would always look at the liver and the spleen, right? So, depende. Kung masyadong slippery, you would not be able to feel the kidney pulses. Masyado siyang deficient. Okay? Yan. And make sure that you are able to effect a change in the pulses before you needle. Actually, that's what I do. So, pinapafeel ko din yung pasyente. Medyo parang ano niya, yan. Nakikita niya yung change. So, I usually use the ear to do that. Yun. Okay. Next, at what distance to the medial malleolus does the spleen, this was kanina, does the spleen primary channel cross over from the posterior border of the tibia to travel anterior to the liver channel? How many tune?
3.
No.
8, Doc. And 8, sir.
From the spleen 9 to the medial malleolus. Or
Ayun yung 8.
leg mo. Di ba sa
So, yun yung... Oo. Yun yung...
this one, gano'n, no? Gaganon mo. Ay, nako. Gamitan nyo ng probe. Napaka-effective niya. 8 soon. Okay? 8. Okay, the spleen primary channel ascends along the medial aspect of the knee and the anterior medial aspect of the thigh going to where?
The abdomen, lateral to the midline to the second intercostal space.
Ang taas na yata, ano muna, the lower abdomen. Doon muna tayo sa lower abdomen. Okay? Galing siya sa knee, medial aspect ng knee, and then, kaya middle spleen 10 or spleen 9, may ma-feel siya parang may umaakyat papunta sa kanyang lower abdomen. Okay, in the lower abdomen, the spleen primary channel intersects the conception vessel at what point? There are 3 points of the REN.
And 6.
No.
Then
Ah,
3,
3, 4, 10.
4,
2,
10.
4, and 10.
And
2, 4, 10.
N. REN 3, REN 10.
4, then 10.
Pag medyo
And
may dampness, you should not forget to needle these points. Lalo na pag malaki ang tiyan, ang sarap ito. REN 3, 4, and 10. Okay? Number 27, from REN 10, the spleen primary continues to
GB 24 and liver 14.
it continues to the spleen. And then
Connecting with the stomach.
number, where does the spleen primary channel emerge?
SP21. 6 June inferior to the
Malayo na,
axis.
21, sir. Actually, doon siya mag-emerge sa kanyang kasama. Sino ba kasama?
Stomach.
Stomach.
June, 9, then at 6 June, lateral to the midline.
Again, Doc, can you repeat?
The spleen primary channel, mag-emerge siya sa stomach region. And then, di ba pataas si spleen? Okay. It will ascend first at fortune lateral to the fortune, and then 6th June lateral to the midline. Papunta na siya. Di ba papunta na siya ng, what do you call that point?
Liver 13.
Okay, liver 13. So first fortune, tapos papunta na siya ng 6th June lateral to the midline. Okay. Saan dumadaan na points ang spleen primary? I think we took this up last time. What are the points? Remember, the spleen is related to the lungs. So kahit dapat kasama dyan si lungs.
Kidneys.
So, lung 1.
Lung 1, liver 14, GB 24.
And then si liver naman, ayan, liver 4,
14.
liver 14, sorry. Liver 14 and GB 24. Okay? Liver 14 and GB. Okay, anong front mo si liver 14?
Liver.
Yeah. Si liver 13?
Spleen.
Very good. Number 30. Where does the spleen primary channel terminate?
Ito na yata yung spleen 21.
Binilisan mo lang. Okay, pang ilang intercostal space?
4.
7.
Second.
7.
7th intercostal space. Saan ang location niya? Using the
Axillary line.
axillary line. Tune from the midline. How do you needle spleen 21? Do you needle it or subcutaneous siya? Okay. You tried doing this sa mga malalaki ang tiyan, lalo na pag diabetic. Very tender to at napaka-relaxing. Remember, this is the last point of the spleen channel. Okay? So you have to locate it in the seventh intercostal space, mid-axillary line. Okay?
Pipindutin lang, Doc.
Hindi, i-ano mo, sub-Q lang po. Sub-Q. At
Subcutaneous. Nakahiga.
usok, very risky. Actually, very tender siya. Oh, it's called the Great Luo Connecting, di ba? A great, great luo. Now, the spleen primary channel connects with which Zangfu organs? Marami siya.
Saan na ba?
Can you mention the Zangfu organs?
Stomach, lung, heart.
Diaphragm, the tongue, of course. Diba? Tongue. Spleen, stomach, heart, the diaphragm, esophagus, tongue. Okay. 32. The stomach primary channel connects with what Zangfu organs and tissues?
Stomach, spleen.
Okay, stomach and spleen din. Kasi remember, kailangan alam niyo yung difference ng stomach channel sa stomach organ. Okay, stomach primary channel connects with stomach, spleen. What else? Di ba pag may ano ka sa stomach, namumula yung ilong mo. So, nagko-connect din siya sa nose, nagko-connect siya sa eyes, and also sa mouth, of course. That's why you have some, tawag ito, yung canker sores. Upper teeth, remember, it also connects with the breast and the diaphragm. Di ba tumadaan sa breast? Number 33, the luo connecting channel of the spleen originates at what point?
Spleen 4.
Good. The spleen luo channel goes from spleen 4 to connect with the stomach channel and then enters the abdomen to connect with
The large intestine and stomach.
both small and large. Small and large intestines and the stomach.
Okay.
Okay. Ito yung correction. Thank you, Ma'am Lynn, for bringing this to my nahilo na yata. Okay, the spleen great luo channel separates from the primary channel at 21 on the lateral aspect of the chest, spreads through the chest and the lateral costal region where it gathers what?
The
Bakit masakit siya?
blood of the luo connecting channels.
Of the whole body.
Whole body.
Yes, very good. Congratulations. Spleen divergent channel branches from where?
Near spleen 11.
Okay, middle of the anterior thigh. Middle lang sila, no? Hawakan mo, masakit siya. Middle of the anterior thigh. Okay. Yan pala. Number 37, the spleen divergent travels where? From the anterior of the thigh. So from the anterior of the thigh sa middle, saan siya pumupunta? Siyempre, connecta. Okay?
Abdomen in the inguinal region.
Papunta sa throat.
30.
Then papasok sa tongue. Right? Maganda. In fact, if you have a very effective treatment, you will notice right after the session, nag-i-improve yung coating ng tongue. Okay? Numinipis. Ay nako, you'll be amazed. Okay, sorry. Number 38. The small intestine primary channel originates where?
On the little finger on the ulnar corner of the nail at SI1.
Okay. Ulnar side, tip of the little finger. Very easy. From SI1, the primary channel ascends along the ulnar aspect of the hand to reach the wrist where it does what? Saan siya lumalabas? Anong point?
Continues along the ulna to the medial aspect of the elbow.
The styloid process muna. Yeah, styloid process of the ulna at SI6. Sa wrist pa tayo eh. Okay, pagdating sa wrist, nag-emerge siya sa styloid process ng ulna at SI6. And finally, from SI6, its primary channel follows the ulna. Ito na po yon. Medyo nag-advance kayo. Follows the ulna to the medial aspect of the elbow, where it passes between what?
The olecranon and the medial epicondyle.
Humerus.
Yes.
At what point? SI?
8.
Okay.
SI8.
Congratulations, Sir Victor. I know it's a bit stressful. Saka may correction tayong gagawin mamaya pa. Hindi ko nakalimutan ko tuloy. Thank you for bringing that to our attention. Maraming salamat, Sir Victor. Now let's
Thank
call.
you po.
Good evening, Sir Michael R.
Good evening, classmate, doctors.
You look good. You look better now with that big ear behind you.
I changed my my setup in my place.
Wow. So happy and confident. Marami ka na sigurong na-treat. No?
Oh, focus pa rin po sa trabaho to. I have a lot of in my table. So anyway, we need to go after our studies. This is more important work.
Okay. From SI8, the primary channel runs along the posterior aspect of the upper arm, intersecting, that's intersecting, not interesting, intersecting other channel.
Okay. My answer, doc, is intersecting the large intestine channel at LI14.
Good. After intersecting with the LI channel at LI14, the primary of SI travels the posterior aspect. Ito na yung kinorek ni Ma'am Lynn, no? Thank you for the correction.
Okay.
Of the SI travels posterior aspect of the shoulder joint at what point?
Answer to the posterior aspect of the shoulder joint at SI10.
Wow. After passing SI10, the primary then...
Yeah, I have a long answer with this one. SI primary channel zigzag from the inferior fossa to the superior fossa of the scapula through the SI11 and SI12. Then the medial aspect of the scapula is found at ST or stomach 34.
SI13. Actually, if mention mo, you have to press them to find out if they are tender. So pag
okay.
Them. Okay? Especially
okay po.
in SI12. Okay? Okay. Number 44. After zigzagging, the SI primary crosses SI14 and SI15. This will travel where?
SI primary crosses to SI14 and 15 to do 14 to the lower border of the spinous process.
Galing. Okay.
Stop. Sabihin ko, C7.
Pwede na. Alam mo na yan. Number 45. At do14, the SI primary channel intersects which channel?
In bladder channel at bladder 41 in bladder 11.
Okay. Anong significance nito? Like, talking about the bladder and the SI. It's Di ba tayang yan?
Opo, tayang.
So, ibig sabihin, if you have wind heat invasion or wind cold invasion, you can actually cup the bladder 11. Di ba sumasakit yung batok? Okay.
Opo. Especially stress.
Yeah. So remember the do intersects the blood at bladder 14 and bladder 11. After intersecting with the bladder, the SI channel then descends into the supraclavicular fossa to connect with
Stomach 12 equipment and connect with the heart.
the heart. Yeah.
Uh,
Di ba magkapatid magkasama si SI pati si heart. After connecting, the primary intersects the conception vessel at
Ren 17 po.
then,
And pass through the diaphragm to the stomach.
very good. SI primary intersects with the conception vessel at REN 13 and REN 12, then
Enter to the small intestine.
good. Okay. Lalo na pag tumutunog yung borborygmus, don't forget to needle REN 12 and REN 13.
Noted po yan, Doc.
Now, SI luo connecting channel separates from what point?
SI7 connect with the heart channel then.
Very good.
From the small, from the small intestine.
The luo of SI travels along the arm to connect with the shoulder, where?
And large intestine 15. Joel.
Divergent channel separates from the primary channel at the shoulder to enter where?
Axilia. Axilia.
Ano niyan sa Tagalog?
Sorry, Doc.
After entering the SI divergent channel crosses where?
Crosses the heart and descend the abdomen where it connects with the small intestine.
Good. The SI primary channel connects with which Zangfu? So, number 1 na dyan ang heart, di ba?
Opo. Tatlo po to, Doc. Ang ano ko po, heart, stomach, and in small intestine.
What else?
Yan na po yung nakuha ko sagot ng niresult ko.
Here. The ear.
Heart, ear. Okay.
The inner canthus of the eye. Di ba connect? Okay. The primary channel of the heart originates where?
In the heart.
Yes. The heart primary channel emerges from
The heart primary emerges from the system of the vessel, from the blood vessel surrounding the heart, and descends to the diaphragm.
Okay. The primary of the heart descends the diaphragm to connect with
the small intestine.
the channel connects with what Zangfu?
Tatlo rin yung sagot ko, Doc, heart, lungs, and small intestine.
And tissue surrounding the eye.
Tissue surrounding the eye. And tissue.
Okay.
Okay po, Doc.
Number 58, the heart lower channel separates from where?
From the heart channel of heart 5 connects with the small intestine channel.
Good. The luo of the heart channels
is from the heart, follows the heart channel to the heart sung, then continues to the root of the tongue and the eye.
Okay. Okay. Kaya connected siya with the kidney, remember?
Kaya pala.
Now you're
Root of the tongue.
The heart divergent channel separates from the
divergent channel separates from the primary channel of the axillary fossa.
Maraming salamat, Sir Michael. Thank you so much and congratulations. We're very proud of you.
Thank you po, Doc.
Thank you. Now let's call on Ma'am Lynn. Ma'am Lynn, good evening.
Good evening, Doc.
Bilib talaga. Ako nakita talaga yung mga mali. Kakahiya. Okay. Sige lang.
Kasi mahanap yung sagot, Doc. Hanap ko talaga siya.
Okay. The divergent heart channel enters the chest to connect with
the heart.
Yes. The heart divergent ascends along the throat and then emerges where?
Emerges on the face.
Kaya nag-iiba yung kulay ng mukha. So, pag mabutla, dapat nag-iba yung kulay. Kaya dapat alam natin to. Where does the heart?
Either namumutla or namumula.
Yes. So kung pulang-pula yung mukha niya, kailangan mawawala yung pula or mabawasan man lang. Where does the heart divergent channel connect with the SI channel?
At the inner canthus.
Very good. The primary channel of the bladder begins where?
At the inner canthus of the eye at bladder 1.
Okay. From bladder 1, the channel ascends where?
Ascends along the forehead to the vertex to intersect with GB15, DO24, and DO20.
Very good. GB15, DO24, and DO20. The UB luo channel separates from what?
From bladder 58.
Bladder 58. Kaya napaka-importante. The points that we were mentioning, you need to needle them, especially if you don't know what to do. Grabe yung impact niyan. Ito, favorite point ko to, bladder 58. Especially pag merong issue with the kidney. Okay? Lalo na yung mga low back pain, knee pain, ay napakagrabe ng impact. Aside from bladder 40, of course. Bladder 58. Yeah. The UB divergent channel diverges from the primary channel from
the popliteal fossa and ascends to a point from the popliteal fossa po.
Yeah. At that point, how many tune inferior to the sacrum?
5 tune.
5 tune. Very good.
But na ako dapat.
Divergent of the bladder connects with the bladder and disperses in
the kidneys.
The divergent of the bladder ascends along the spine, disperses in the cardiac region, then emerges where?
Neck.
Okay. Kaya sumasakit yung nape natin. So this is what you should do to rejoin the bladder primary channel. Number 70, the primary channel connects with what? The UB primary channel connects with what, Zangfu?
The kidneys and the bladder.
What else? The eye. Ano? Sabi niya, may tumiwanag yung pang... Okay. The brain. Okay, don't forget the eye, brain, ear. Kidney, bladder, eye, brain, ear. Where does the kidney channel begin?
Beneath the little toe.
After crossing the sole of the foot to meet kidney 1, the kidney primary pathway emerges where?
At the point kidney 2.
Okay. Anterior and inferior to the navicular.
Tuberosity.
After winding around the ankle and ascending the medial aspect of the leg, the kidney primary channel intersects what channel? 3 tune superior to the medial malleolus. Very popular.
Spleen channel at spleen 6.
Very good. From kidney 10 on the medial side of the popliteal fossa to ascend what aspect of the thigh?
The posteromedial aspect of the thigh.
Okay, going to the tip of the coccyx, where it intersects the governing vessel at what point? To what?
Number
75.
Number 75 at REN 3, REN 4, and REN 7.
Yeah. So where does it connect? REN 3, REN 4, and REN 7. One branch of the kidney emerges from the kidney and ascends through
the liver and the diaphragm.
And then it enters the lung. Kaya kita mo talaga yung relationship nila with the lung. Especially when the patient would say, bigla siya naging asthmatic pagtanda niya. This is the reason. Number 77, after entering the lung, where does the kidney branch that begins in the kidney terminate?
At the root of the tongue.
Good. So you should not forget to look at the tongue. Actually, you should really flush a light, no? Or you have to really use natural light. A branch of the kidney channel separates in the lung to join with
the heart, and then it disperses into the chest to link with the pericardium.
and then REN 7. Number 79, the primary channel of the kidney connects with which organs?
The kidney, the bladder, the lung, the liver, and the heart.
Okay, also the pericardium, the root of the tongue, the throat, the spine, and the diaphragm. Number 80, the kidney divergent channel separates from the kidney primary channel from where?
In the popliteal fossa.
To intersect with the bladder channel located on the thigh. Maraming salamat, Ma'am Lynn. Very good, excellent, and thank you for your help. It's good that talagang ano.
Hindi ko kasi talaga mahanap yung sagot doon sa ano doon, kaya hinanap ko siya.
Okay. Okay, for the last ilang questions to 18 na lang, no? 81 to 98. Can I call on Ma'am Cheryl Bahamundi? Good evening po. Ma'am Cheryl.
Doc, good evening. I don't have answers for
Ayun
tonight.
Okay, let's just answer this together. All of us.
Thank you, Doc.
Okay. The kidney divergent ascends the thigh where it connects to the bladder to connect with the kidneys and cross which vessel? Which
Girdling.
Gurgling
vessel.
the belt, the girdling. In the region of, saang region yan? You have to be
Second lumbar. Vertebra.
Okay, number 82. Sige, answer. Tayo na lang lahat mag-answer. After crossing the... I thank you pala nito, Sir Victor, no? Hindi ko na-correct. Daimai ito, ha? Di ba? Yeah, daimai. At lumbar 2, balik continuation ng previous, no? The kidney divergent channel continues upward to the root of the tongue and emerges where?
Nape of the neck.
Okay, and then connects with what channel?
Bladder primary channel.
Ngayon nakita nyo na, ha? Pag stress ka, affected si kidney, affected din si bladder, affected si nape of the neck. Overwork. Now you know. The law of the kidney channel begins where?
Kidney 4.
Kidney 4.
On the posterior aspect of?
Medial malleolus.
Yeah. By the way, ano ba impact ng luo? It will affect the bladder. Diba?
Hair.
The luo of the kidney encircles and enters the heel to connect with what channel?
Bladder channel.
Very good.
Bladder.
Parating bladder. The kidney luo connecting channel ascends along with the kidney channel from kidney 4 to a point below what?
The pericardium.
The pericardium. Ang galing. Huwag niyong kalimutan si kidney 4. Kung, of course, si kidney 3. So luo connecting kidney. Where does the pericardium primary channel originate?
Center of the chest.
Very good. What does the pericardium primary channel connect with?
Pericardium.
Huh? Nagdi-descend siya papunta sa diaphragm to the abdomen. Diaphragm nagdi-descend. Kailangan siya mag-descend, no? Yung pericardium. Papunta sa diaphragm to the abdomen. The pericardium primary channel passes through what jaw?
Upper, middle, and lower.
Upper, middle, and lower.
Yeah, all three of them. One branch of the pericardium runs from inside the chest to emerge in the intercostal region, 3 tune inferior to the anterior axillary fold near PC1, arches over the axilla to where?
Along the
upper
anteromedial aspect of the upper arm.
upper arm, yeah, along the anteromedial aspect of the upper arm.
So this could probably explain kung meron ka ng heart attack, sumasakit yung ano. Meron ba nakaka-relate dito? Ano na pag nasa...
Wala pa.
Ano yung pangalan ko, Dok?
Oh, di ba? Kaya inihintay ka lang namin sumagot.
Bigla na lang may sasagot.
Thank you for being honest, Sir
Michael.
Then, itong pericardium 3, napakagrabe ito. From PC3, the channel continues to descend the forearm between the tendons of the palmaris longus and flexor carpi radialis muscles to reach the palm at PC8 to travel to
PC9.
Middle finger.
PC to the
Middle finger.
along the middle finger
Yes. Ito naman,
to the PC9.
yes, another branch of the PC arises in the palm and finger.
Palm and ring finger.
Oh, kasi nandun si triple birth sa Sanjiao naman, di ba? Ngayon nakita nyo na yung kanilang connect. The PC connects with the following Zangfu
Sanjiao.
and diaphragm. What is the PC luo connecting point? Okay, you should be careful when you needle PC6, no? Wag mong laliman. You have to be very precise. Kasi baka medyo magulat yung pasyente kasi grabe yung
May kuryente.
kuryente talaga. Kasi if you needle it deeper, may hindi magandang impact. So, don't be too aggressive. As long as you're confident, just needle it fast. Kung mafe-feel na siya. And you have to caution him pa hindi na siya sumigaw. PC6 connects with what?
Pericardium.
The heart. Remember, it can actually improve the chi. Connection agad sa heart. Para bang inano mo siya, binuhay mo. Siyempre, yung pericardium nasa heart, kaka-cover sa heart yun. So where does the PC divergent cross over?
Ren 17.
No. Ang separate
Throat.
from arm.
Throat.
Ear and Sanjiao.
Yeah, the throat. The PC
Throat,
luo
ears.
channel begins where? Kanina
P6.
ito. Yeah, anterior of the forearm, PC6.
PC6.
Divergent channel separates from the PC primary channel on the arm at the level of what point?
Trichun.
P1.
Sa axilla,
GB12.
inferior to the axilla.
Axilla, trichun inferior
Trichun, inferior to the axilla.
enters the chest to communicate with the Sanjiao, the three jiao.
Communicate with the three jaws. Yes.
After connecting with the three jiaos, the divergent channel of the PC channel ascends across the throat and emerges where?
Behind the ear.
Behind the ear. Converge with the Sanjiao channel. Maraming
Sanjiao
salamat po. That was very exhausting and congratulations to everyone. You did so good. You did so well. Congratulate yourself. Okay.
Thank you, Doc.
Hope to see you again next time. We'll go off air muna. We'll stop